This is your assessment for knee flexion. It's also an assessment of quad length. So we're going to lay face down and we're going to bend a knee. And so you want to stay pretty relaxed. Ideally, this one definitely works better if you have someone helping you because they can also kind of assess whether or not your pelvis and back are moving. You might not feel movement, but they might see movement. So you have someone take your relaxed leg and kind of bend it up. But you could also do this by yourself and video where things are going. And so this is just testing your active knee flexion. Mine's not very good. This is the one part of my body that is kind of a short muscle, my quads. And so if somebody takes my leg passively, what they wind up seeing is that my hips roll away as they bend it up. They roll off to the left. So that's a fault. You don't want to see that happening. That means like, oh, stop there. That's the end of your passive range before it's starting to affect your other tissues. So you just want to be careful of what things you're doing. Like for example, sissy squats. If you don't have really good like long quad knee flexion, you don't really want to go super deep in your sissy squats because that could be really causing some low back tension, basically, things that are having to accommodate the lack of range there. All right, that's your quad length / knee flexion assessment.